What if your body already knows you're pregnant, and it's been trying to tell you for days? Not after a missed period, not after a positive test. Right now, today, because here's what most people don't realize. Your body starts changing within days of conception, and it sends out signals. Quiet ones that are very easy to mistake for something else entirely. Today I'm walking you through 12 of those signals, ranked from the ones that show up earliest to the ones most women overlook completely. Stay until the end because number 12 is the one nobody talks about, and it might be the most telling sign of all. Let's go. Sign number 1, implantation bleeding. This one can genuinely trick you into thinking your period arrived early. You see a little spotting, light pink or brown, not red, and you think, okay, period's coming. But here's the difference. This bleeding typically lasts 1 to 2 days maximum. A real period builds up and flows. Implantation bleeding shows up, barely registers, and quietly disappears. What's happening inside your body is actually remarkable. The fertilized egg is just burrowed into the lining of your uterus. 6 to 12 days after ovulation, that burrowing causes a tiny bit of bleeding. That's your embryo making itself at home. Some women also feel mild cramps alongside this. And here's a critical warning. If that cramping is sharp and only on one side of your abdomen, please see a doctor. That can be a sign of ectopic pregnancy. Don't ignore it. Sign 2. Your breasts feel like they've been personally offended. I'm talking sore, tender, sometimes even painful to touch. You might notice they feel heavier, fuller, or that the area around your nipples has darkened slightly. This happens because estrogen and progesterone surge almost immediately after conception, flooding your breast tissue with increased blood flow and fluid. Your body is already, this early, beginning to prepare for the possibility of feeding a baby. If your breasts feel noticeably different from your usual pre-period tenderness, that's worth paying attention to. Sign 3. You are exhausted in a way that makes no sense. Not just tired, bone tired. You slept 8 hours and you still feel like you need a nap by 10 a.m. Here's why. Progesterone, the dominant hormone of early pregnancy, has a powerful sedating effect on the body. And on top of that, your body has just taken on a completely new job, building a human. Your heart is already pumping more blood. Your metabolism is already shifting. Your immune system is actually suppressing itself slightly so it doesn't reject the embryo as a foreign body. All of that costs enormous energy. The exhaustion is not in your head. It is your body doing extraordinary work. Sign 4. Nausea at any time of day. We call it morning sickness, but that name is completely misleading because it strikes at 2 p.m., at dinner, at midnight, whenever it feels like it. The culprit here is HCG, human chorionic gonadotropin, the pregnancy hormone that home tests detect. As HCG rises rapidly in early pregnancy, it triggers nausea receptors. And here's something interesting. Research shows women carrying higher HCG levels tend to experience more intense nausea. So if you feel absolutely awful, counterintuitively, that can actually be a reassuring sign. Sign 5. Food that you love suddenly disgusts you. Not just nausea. Specific, targeted hatred toward foods you were completely fine with yesterday. The smell of chicken cooking, your favorite coffee, someone's perfume in the lift. These things can trigger an immediate visceral reaction. Rising estrogen dramatically sharpens a sense of smell in early pregnancy, and scientists believe this is evolutionary. Your body is steering you away from anything that could potentially be harmful to a developing embryo. So those sudden aversions, your biology is doing exactly what it was designed to do. Sign 6. You cannot stop going to the bathroom. Before you've even missed a period, you might notice you're making more trips to the toilet than usual. Day and night. HCG stimulates the kidneys to filter blood more rapidly, and increased blood volume puts extra pressure on the bladder. The result, frequent urination that starts earlier than most people expect. Now, one important distinction. If urinating comes with burning, pain, or discomfort, that's a urinary tract infection, not pregnancy. Pregnancy-related frequent urination should be painless, just persistent. Sign 7. Your basal body temperature stays high. This one is for the women who are actively tracking their cycles. And if you're not, this is your sign to start. Normally, your basal body temperature, your resting temperature taken first thing in the morning before you move, rises slightly after ovulation, and then drops just before your period begins. But in pregnancy, progesterone keeps it elevated. It doesn't drop. It stays up. If your temperature has been consistently higher than your pre-ovulation baseline for more than 18 days straight, that is a strong, reliable early indicator of pregnancy. No kit required. Sign 8. Bloating that feels different from your usual PMS bloat. Progesterone relaxes smooth muscle, and that includes the muscles of your entire digestive tract. This slows everything down. You feel gassy, full, heavy, and uncomfortable, even when you haven't eaten much. The confusing part is that this feels almost identical to premenstrual bloating. The difference women often describe is the timing. It starts earlier in the cycle than expected, and the persistence. It doesn't ease up the way PMS bloating usually does as the period approaches. Sign 9. Mood swings that are more intense than usual. You cried at an advert. You snapped at someone you love over something tiny. You felt completely fine 10 minutes later. Early pregnancy hormonal shifts, particularly the rapid rise of progesterone and estrogen, directly affect the neurotransmitters that regulate mood. Serotonin, dopamine, all of it gets disrupted. The key difference between pregnancy mood swings and PMS mood swings? Intensity and unpredictability. Pregnancy-related emotional shifts tend to feel more extreme, more sudden, and less connected to an obvious trigger. Combined with fatigue, they can feel overwhelming. Sign 10. Your heart is beating noticeably faster. This one surprises people. You're sitting still, doing nothing, and you can feel your own heartbeat. Maybe it feels like a flutter. Maybe it feels like low-grade anxiety that came from nowhere. What's actually happening is your cardiac output, the amount of blood your heart pumps per minute, begins increasing almost immediately after conception. Your heart rate rises by roughly 10 to 20 beats per minute above your normal resting rate. Your body is already preparing to supply an entirely new circulatory system. If you feel this at rest and there's no obvious explanation, it is worth noting. Sign 11. Dizziness when you stand up. You get up from the couch or out of bed, and for a few seconds, stars. The room tilts slightly. You have to grab something. Here's the science. Early pregnancy causes vasodilation. Your blood vessels widen to increase blood flow toward the uterus. When you stand up suddenly, blood rushes downward into those widened vessels before your body has had time to compensate. Your brain gets slightly less blood for a brief moment, hence the dizziness. It's harmless in most cases, but if it's severe, frequent, or accompanied by fainting, speak to your doctor. And sign 12, the one that barely gets on the list. A heightened, almost supernatural sense of smell, not just noticing smells more, being overwhelmed by them. Smells that never registered before suddenly become overpowering. A neighbor cooking 2 floors up, someone's deodorant across the room. This is caused by sharply rising estrogen levels, which sensitizes the olfactory system far beyond its normal range. And researchers believe this is entirely intentional. Evolutionarily, your body is scanning the environment for anything that could be toxic or harmful to a developing embryo. Your nose essentially becomes a protection system. Women describe this as one of the most distinctive and unmistakable signs, because it doesn't feel like anything else. It doesn't feel like PMS. It doesn't feel like illness. It feels like your senses have been quietly and suddenly upgraded. Now here's what I need you to hear before you go. Not every woman experiences all 12 of these. Some women sail through the first weeks with barely a symptom. Others feel every single one of these from week 2. Both are completely normal. Your body writes its own version of this story. What these signs give you is awareness, especially if your cycles are irregular and you don't always know when to expect your period. These signals can prompt you to test earlier, to pay attention sooner, to get care faster. And if your test comes back negative, but these signs are getting stronger, not weaker, go to your doctor, ask for a blood test. A blood test can detect pregnancy hormones before any home kit can. Your body is speaking. These are 12 ways it might be saying something incredible is beginning. If this video helped you, share it with someone who's trying to conceive. She needs to see this. Drop in the comments which sign showed up for you first. Subscribe for more evidence-based women's health content every week. And I'll see you in the next one.